How often should seniors take a bath after 70? 6. Shocking facts you need to know. All right, let's be real for a second. We all know that taking a bath is something we do every day without thinking twice. But here's the thing. When you hit 70, things start to change. Bathing isn't just a simple task anymore, and you might be surprised to learn that what's normal for someone younger might not be so great for our seniors. So how often should seniors really be taking a bath? And how do we make sure it's done safely and effectively? In today's video, I'm going to share with you 6 shocking facts about bathing after 70 that you absolutely need to know. Trust me, some of these will surprise you. But more importantly, understanding these facts could help keep your loved ones safe, healthy, and feeling their best. So stick with me, because we're diving into this sensitive topic with facts that might change the way you think about bathing and hygiene in older age. Let's get started. Part 1. The physical changes. After 70. Let's kick things off by talking about something that happens to all of us as we age: our skin. Now think about this for a second. When you were younger, you could hop in the shower every day, use hot water, and your skin would bounce right back. But after 70, things aren't that simple anymore. The skin, which used to be thick and elastic, starts to thin out. It loses some of its protective oils and becomes more fragile. This means that how we bathe becomes a lot more important. Did you know that after 70, your skin can lose a significant amount of its natural oils? This makes it easier for your skin to get irritated or dry out. That's why a long hot bath might actually do more harm than good. For seniors, frequent bathing can leave the skin cracked and uncomfortable. And we're not just talking about dry skin here. This can lead to more serious issues like rashes or even infections if the skin isn't properly cared for. So what's the solution? Well, less frequent bathing can actually be beneficial for preserving those precious oils. But the trick is to balance it. You don't want to go too long without cleaning either. The goal is to find that sweet spot where the skin stays healthy and moisturized. If you're caring for an older loved one, keeping their skin soft and protected should be a priority. But as with most things, there's a fine line. Not enough bathing can lead to hygiene issues, but too much can leave the skin vulnerable. It's all about finding that right rhythm for the individual, and that means paying attention to their specific skin needs. Trust me, I've seen this firsthand with my own family members. If you're noticing dry patches, irritation, or redness, it might be time to rethink how often you're bathing. Part 2. The impact of bathing on mobility and safety. Now let's dive into something we don't often talk about: mobility and safety. As we age, our muscles get weaker, our joints get stiffer, and our coordination isn't as sharp as it once was. If you've ever helped a senior get into the tub, you know that it can be a challenge. Even a simple task like bathing can turn into a dangerous situation if they're not properly supported. Here's the reality. Seniors are at a higher risk of slipping and falling in the bath or shower. And we all know that falls are one of the leading causes of injury in older adults. What might seem like a harmless activity can actually cause a serious fall if the proper precautions aren't in place. Imagine a senior with arthritis or limited mobility trying to step into a slippery tub. It's a recipe for disaster. This is where safety becomes critical. If you're bathing your loved one or if you're a senior yourself, think about safety features like grab bars, non-slip mats, or even a shower chair. These tools can help make the bathing process safer and more comfortable, reducing the risk of dangerous slips. But let's not forget about the energy it takes to get in and out of a tub. For seniors, a long soak can leave them exhausted. The simple act of getting in and out can strain the joints and make them tired, which isn't ideal for anyone's health. This is why sometimes a quick shower can be much safer than a long, drawn-out bath. From personal experience, I've seen family members struggle with this. What used to be a peaceful bath time has turned into a tiring and risky ordeal for seniors. That's why sometimes less is more. A quick, safe shower with proper support can do wonders for both their physical and mental health. Part 3. Shocking fact. Number 1. Bathing too much can lead to health risks. let's talk about something that might surprise you. Bathing too often can actually cause more harm than good. I know it sounds counterintuitive, right? We've always been taught that the more we clean, the better we feel. But as we age, our skin's natural balance starts to change, and overbathing can have some serious consequences. When you shower or bathe too often, especially with hot water, you risk stripping your skin of the natural oils it needs to stay healthy. These oils act as a barrier to protect the skin from the environment, so if you take too many hot showers, you might be unknowingly making your skin more vulnerable. Dryness, irritation, and even cracking can become big problems. For seniors, whose skin is already thinner, the effects can be even worse. But here's the kicker. When you remove these oils, your body tries to compensate by producing more oil. That can leave you feeling greasy or uncomfortable, and it can actually worsen skin conditions like eczema, psoriasis, or even fungal infections. These are conditions that are far more common in older adults, and overbathing can aggravate them. This is where the balance comes into play. Bathing too often isn't necessary for seniors, and it could actually worsen their skin health. Instead of a daily bath, it's better to adjust the routine based on individual needs, maybe 2-3 times a week, depending on activity level and the skin's condition. It's not about being dirty. It's about taking care of the skin and not overloading it with unnecessary exposure to hot water and harsh soaps. I know this sounds like a small thing, but it's something many don't think about. After my grandmother had a few skin issues from overbathing, we started spacing out her showers, and the difference was immediate. Her skin was softer, and the irritation started to disappear. Part 4. Shocking fact, Part 2, bathing too little can be harmful. 2. Okay, so we've covered the risks of bathing too often, but let's talk about the other side of the coin, bathing too little. Just as overbathing can be problematic, neglecting hygiene can lead to some serious health issues as well. I know it might seem easier to skip a bath every now and then, but for seniors, this can have some unexpected consequences. You see, when you don't bathe enough, bacteria, sweat, and dead skin cells start to build up. And for older adults, this buildup can lead to fungal infections, body odor, and other hygiene-related problems that aren't just uncomfortable. They can be dangerous. For example, seniors who don't bathe regularly might develop rashes, fungal infections, or even more serious skin conditions that can be hard to treat. In fact, older skin is more susceptible to infections because the immune system weakens with age. When the skin barrier is compromised, it's a clear invitation for bacteria to enter, which can lead to things like pressure sores or skin ulcers, especially if the person is immobile or bedridden. In addition to physical health concerns, neglecting bathing can affect mental health as well. Bathing is an activity that provides a sense of normalcy, comfort, and dignity. It's an opportunity to care for oneself. When that routine is neglected, it can lead to feelings of depression, low self-esteem, or even social isolation. I remember a time when my grandfather started skipping his showers. At first we thought it was just laziness, but soon we realized it was more than that. He was becoming withdrawn, and his skin wasn't in great shape. We helped him establish a simple bathing routine, and the positive change was incredible. His self-esteem improved, and he started interacting more with the family again. Sometimes the simplest things like a regular bath can have a huge impact on a senior's mental and emotional well-being. So, while bathing too much is harmful, bathing too little is also something to be cautious about. It's about finding that balance, ensuring hygiene is maintained without overdoing it, and always paying attention to your loved one's needs. Part 5. Shocking fact. Part 3. Water temperature matters more than you think. Here's something that might not cross your mind every day. Water temperature. You probably know that a hot bath feels amazing after a long day, but for seniors, hot water can actually be a big problem. It's not just about comfort, it's about the health of their skin and the risks involved in using water that's too hot. When the water temperature is too hot, it can strip the skin of its natural oils, leading to dryness, irritation, and even skin conditions like eczema. For older adults whose skin is already thinner and more sensitive, this effect is even more pronounced, and, If you're thinking about the mental aspect of a hot bath, it might feel great for a moment, but it can actually cause the body's blood vessels to dilate, lowering blood pressure and increasing the risk of dizziness or fainting. But it doesn't stop there. Water that's too hot can cause dehydration, making it harder for the skin to stay hydrated and retain moisture. This can also be especially dangerous for seniors who already struggle with hydration or conditions that make their skin prone to dryness. So, what's the magic temperature? Lukewarm water is the answer. Aim for something comfortable. Not too hot, not too cold. This will help keep the skin in good condition without triggering dryness or discomfort. I know it might seem like a small thing, but believe me, it makes a world of difference. I learned this the hard way after seeing my grandmother become really uncomfortable after a hot shower. After we switched to lukewarm water, she felt much better and her skin was more hydrated. Remember, it's not just about the temperature of the water, it's about respecting your loved one's skin, health, and comfort. So, keep it cool, or at least lukewarm, and you'll make a big difference in their well-being. Part 6. Shocking fact. Number 4. Showers versus baths. Alright, here's a big debate. Showers versus baths. Which one is better for seniors? If you've ever had this discussion, you know it's a personal preference. But when it comes to seniors, the choice between the two can have a huge impact on their health and safety. Let's start with baths. While a long, relaxing bath might sound wonderful, it can actually be a bit of a hassle for seniors. For one, getting in and out of a traditional bathtub can be challenging, especially for those with arthritis, limited mobility, or balance issues. And let's not forget about the risk of slipping. A fall in the bath can result in serious injuries that could have long-lasting consequences. But here's where showers come in. A shower is often the safer option. With the right modifications, like a shower chair or grab bars, a shower can provide a quicker, more efficient way to stay clean without the risk of a fall or the energy drain of soaking in a tub for long periods. From my own experience, I've seen how a shower can make a huge difference for my elderly relatives. When they switched from baths to showers, they felt more independent and comfortable. It didn't feel like a daunting task anymore. A quick shower became something they could do on their own, which also gave them a sense of dignity and control. Now, that's not to say that baths are entirely out of the picture. Some seniors still enjoy the relaxation of a bath, and it can be a great way to soothe aching muscles or joints. The key is knowing when a bath is appropriate and ensuring that it's safe, maybe with a walk-in tub or the assistance of a caregiver. Ultimately, the decision between a bath and a shower comes down to individual needs and safety. It's all about comfort, accessibility, and making sure your loved one feels as independent as possible while staying safe. So, before you grab that towel and bath bomb, think about the best option for their health and safety. Part 7. Shocking fact. Number 5. The psychological effects of bathing routine. Let's dive into something that many people overlook when it comes to bathing. Mental health. Bathing isn't just about hygiene. It's an experience that can have a huge impact on a senior's emotional well-being. You might not realize this, but the routine of bathing can provide more than just cleanliness. It can give seniors a sense of normalcy, relaxation, and dignity. For many older adults, maintaining their usual bathing habits is a way to preserve their independence and feel like themselves. But when this routine is interrupted, whether due to physical limitations, lack of help, or emotional struggles, it can have a ripple effect on their mental health. For instance, neglecting personal hygiene can lead to feelings of sadness, low self-esteem, or even depression. I've seen it happen with a relative of mine who began skipping showers, and soon enough, they were feeling more disconnected and withdrawn. It's not just about feeling clean, it's about preserving a sense of control and self-care. When seniors are able to care for themselves, even in small ways, it can boost their confidence and help them maintain a positive outlook on life. That sense of accomplishment can do wonders for their mental well-being. In fact, the act of bathing can be therapeutic. Warm water, a gentle wash, and even a few minutes of quiet time can reduce stress and improve mood. Think of it as a mini spa experience that doesn't just cleanse the body but also soothes the mind. From personal experience, I can tell you that helping a senior maintain their bathing routine, not rushing it, not making them feel like a burden, can truly make a difference. And it's not just about cleaning the body, it's about making them feel valued and cared for. That's why it's important to approach bathing with sensitivity and respect, ensuring that seniors feel empowered and relaxed. Part 8. Shocking fact. Verse 6. Bathing can be an indicator of overall health. Now, this might surprise you. Bath habits can actually serve as a warning sign of overall health. I know it might seem like just another daily task, but changes in how often or how a senior bathes can actually point to underlying health issues, both physical and mental. If a senior suddenly starts bathing less often, skipping their showers, or even refusing to bathe altogether, it might not just be a matter of laziness or forgetfulness. It could be a sign of something more serious, like depression, dementia, or physical limitations. For instance, cognitive decline in conditions like Alzheimer's or Parkinson's disease can lead to confusion and forgetfulness, causing seniors to neglect their hygiene. In some cases, mobility issues can make it physically difficult to get into the shower or bathtub. Either way, the bathing routine, or lack thereof, could be a signal that something is off. One personal story I'll share is about my aunt, who had been dealing with early signs of dementia. Over time, she started forgetting her bathing routine, and eventually, we noticed she was avoiding the shower altogether. It wasn't just that she was tired or too busy. She was becoming confused about when or even how to bathe. That was our red flag. We took her to a doctor, and sure enough, it was an early sign of her cognitive decline. By catching it early, we were able to make adjustments and get her the help she needed. This is why paying attention to a senior's bathing habits can be so crucial. If there's a noticeable change, it's worth having a conversation and seeking medical advice. It could be an indicator of something like depression, anxiety, physical pain, or even more serious health issues that need attention. So, if you notice that your loved one's bathing habits are changing, don't just brush it off. Keep an eye on it. The routine may be telling you something about their overall health that needs to be addressed. And always remember, it's okay to seek help and involve healthcare professionals when needed. Conclusion. So, there you have it. 6 shocking facts about how often seniors should take a bath after 70. It's not as simple as it seems, right? Bathing isn't just about staying clean. It's about protecting their skin, maintaining their safety, supporting their mental health, and even identifying potential health issues. There's a lot more to the routine than meets the eye, and it's essential to approach it with care and understanding. What's clear is that when it comes to seniors, one size does not fit all. Some may need fewer baths, others might need more, and the temperature and environment matter just as much as the frequency. It's all about balancing comfort, hygiene, and safety, while still making sure they feel respected and independent. Taking a bath or shower is a small yet important part of our daily lives, but for seniors, it holds so much more significance. It's not just about cleanliness, it's about preserving dignity, mental well-being, and even offering clues about their overall health. If you're caring for a senior, I hope today's video helps you better understand the nuances of bathing routines and how you can make those routines work for them. And remember, this isn't just about facts and figures. It's about the people we love. If you've seen any changes in your loved one's bathing habits, it's always worth having that conversation and looking out for other signs that might indicate they need a little extra care or attention. Health is about more than just physical well-being. It's about making them feel safe, valued, and heard. Thank you so much for watching. If you found this video helpful, please give it a thumbs up, share it with anyone who might need to hear this, and don't forget to subscribe for more content on caring for seniors, health tips, and much more. I'd love to hear your thoughts and experiences in the comments below. How do you approach bathing routines for your loved ones or yourself? Let's keep the conversation going and support each other. Until next time, stay safe and take care.